Everybody, now I invite Dr. Banerjee to present his first case, a case of Anasarca.
Yes, sir.
Very good afternoon to my respected chairpersons, all my respected teachers and dear colleagues. Today we are presenting a case of a lady, 65 years old, who is a housewife residing at Chakradharpur, admitted on 26/2013. She presented with the complaints of swelling all over the body for a span of 2 months, along with passage of further urination. She also gave complaints of breathlessness on exertion for the last 1 month with cough. So to elaborate the complaints, patient was apparently normal 2 months back when she developed easy fatigability and generalized weakness. She also noticed swelling which started from both the lower limbs and gradually progressed to all over the body. Initially, patient was able to perform her day-to-day activities without much of discomfort, but later she developed respiratory distress even while performing normal activities. Patient said her discomfort was more during lying down position. She also gave history of cough not associated with fever. Cough was with mild expectoration which was mucoid in nature, scanty, without any blood. Our patient is also a known case of hypothyroidism over the past 8 years. She is currently taking tablet eltroxin of 50 micrograms every day. However, she is not a known diabetic or hypertensive. There is no past history of hepatitis, malaria, or any history of intravenous drug use. There is no past history of blood transfusion. She doesn't give any history of hematuria. There was no history of any joint pain or rash in the body. On examination, our lady, who was a 55-year-old, was averagely built with a BMI of 22.3 kg per meter square with moderate degree of pallor without any significant lymphadenopathy. She had bilateral pitting type of fetal edema with a pulse rate of 92 per minute, which was regular, normal in rhythm, normal volumic, without any radioradial or radiofemoral delay. The condition of vessel wall was normal. The blood pressure, as recorded in the supine position in the right upper arm, was 160 by 90 millimeters of mercury. Her respiratory rate was 18 cycles per minute and it was thoracoabdominal in pattern. There was no cyanosis or clinically appreciable clubbing. However, there was dystrophy of the nails more in the upper arms on both the hands. Now, in the systemic examination, on auscultation on the chest, we heard bilateral normal breathing sounds with diminished air entry over the subscapular and interscapular areas with impaired resonance over the above mentioned places. The apex beat was at its normal location with first and second heart sounds normally heard without any murmurs or added sounds. The skin on the abdomen was normal without any scar or venous prominences or visible peristalsis. There was, however, parietal pitting edema with shifting dullness and the liver was enlarged more than 2 centimeters. The spleen was clinically not palpable, but hernial sites were intact. The cranial nerves with fundus oculi and other findings of CNS was normal. So to summarize the case, we have a 65-year-old lady who was recently diagnosed as having hypertension with a known hypothyroidism for past 8 years, who presented with Anasarca for the urination and orthopnea. Examination revealed moderate degree of pallor with tachycardia, a blood pressure of 160 by 90 millimeters of mercury, dystrophy of the nails with bilateral pitting type of fetal edema with pleural effusion ascites and hepatomegaly.
Done. Yeah, so this 75-year lady presented recently diagnosed hypertension, presented with Anasarca, an important 40 urine, bilateral, dual effusion, and ascites. So what I get information that dyspnea started after edema. What you mentioned?
Yes, sir. Edema she noticed for the 2 months period.
And dyspnea
Dyspnea was gradually progressive and it was also for 2
Which
months.
started first? Pedal edema or dyspnea?
First edema,
First
followed
pedal
by
edema, then dyspnea.
edema progressed to Anasarca, then she developed dyspnea.
Any opinion from our learned